She treated malaria thinking that, oh, this symptom, it could be malaria. She thought as much, but it was beyond it. Yes, most times if you're living in Africa, you know it's endemic to mosquitoes and the rest, and every little symptom is malaria. And most times malaria drugs are abused. At some point we started having recurrent malaria, resistant malaria, and the rest. But that not the least. She felt it was malaria, quite all good. Most people will not want to spend money doing the test when they will say, even if I do the test, it is still malaria, right? Hello everyone, you're welcome to this channel. This is Nurse Miracle, a registered Nurse Miracle, and I share health tips based on lessons, practical lessons learned that can help you and I and everyone watching this video to live a better and healthier lives. Please like this channel, subscribe to this channel as we follow. If you can also do me a favor, share to your friends and the rest. Thank you. So this particular patient thought she had malaria and had treated. I've seen people treat malaria. They finish the 3 days dose and they stay small and they feel, that one didn't work well, it didn't work well. They go and take another one. Yes, and another one. Well, then it now becomes an issue of resistant malaria. Before they get to the hospital, then it becomes another thing altogether. Okay, so, but I would advise, if you treat malaria once and it seems like those similar symptoms that to you feel it's malaria is still present, I think there is more to it. There is more to it. You should not just keep taking drugs upon drugs. It's not healthy. Please save your kidneys, because that's where even your liver too, all those organs, vital organs, are helpful. Taking too much drugs, it becomes an overdose. You just like using a gun to kill a mosquito. Like, some go higher and higher and higher, and most of these malaria drugs are taken without prescription. People feel, oh, I know how it is done. So, but if you've treated already, it's not advisable you take another dose without trying to visit a hospital to know, I've treated malaria, and then see, I'm noticing this. She was still having weakness, vomiting. She still had body pains, all those signs that make you feel, like this drug do not work. Or sometimes we feel, are you sure it's not fake one? What really went wrong and the rest? But little did she know that it was her kidney failing. Certain symptoms, that's why in medical practice we don't use one symptom and attach to a particular disease. Headache can be attached to several things, so that's why we do a lot of diagnosis, a lot of investigation, so that we can get to the root cause. Because until you hit it on the nail, hammer on the nail, head of the nail, you've not done anything. So that's why when you go, they will ask you questions to know your background, what you've done, and just to gather information to know the direction to go about the treatment. So now, these kidney issues was later discovered, but a bit late. But then certain health interventions was done to help. Imagine if she had stayed home, continue treating, maybe switch from, the way Africans do now, switch from orthodox medicines, all those ones that you take, artemether and lumefantrine, switch from them and start taking agbo, combination of all those native leaves, roots and backs of the roots, and all those ones, stem, boil them, drink. Do you know, with a kidney failing, it can worsen the situation, and most times when they come to the hospital, it's really, really bad. Only the sight of it takes a lot. The kidney can be, dying slowly. Why it's not noticed is that there are 2 kidneys in the body. So if one fails, the other one can still cover and it will be unnoticed. When it becomes a big issue is when the 2 are failed. And of course, kidney transplant is not even cheap, and even to see a donor is another thing. So that's why we must take care of our kidneys, These are very vital organs. If you do not know, your kidney filters a lot of waste in your body that if it is there's a failing or has a problem, a lot of waste will accumulate in your body, causing your body to not function properly. Cells begin to die and the rest because of toxins. Just imagine all sort of rubbish around your house, you to invite cockroach, rats and the rest. That's the same way it will be in the body. So the kidney is not an organ to be toyed with at all. So if you notice these signs I'm about to mention, please do not take it for granted. You need to see the doctor, see it, let them review the condition and then give more better diagnosis. First, if you notice swelling, you just notice maybe around your legs, most times the extremities, you just notice that you are swelling. Like, this one is not fat, oh, don't assume swelling to fat. Some people say, don't they add weight? No, 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 no. You are not adding weight, sister. You are swelling. Swelling means you notice that the rate at which your body is getting bigger is abnormal. When you add weight, it's a process, so it doesn't just happen. But you just wake up and you notice, it's my leg, it's now looking. It's not weight, please, it's swelling. Then you now notice that your urine, the way you used to urinate before, is not the same. You are drinking water, right? But you are urinating very little. Check it. It could be a sign. Could be a sign. That why it is so is that your urine now, your body, the kidney is not working well to filter waste, and then some of the fluid enter back and enter wrong places. That causes that swelling in your body instead of going out, so those toxins and the rest. And if you notice persistent fatigue, you're usually getting tired so often. Please, these 3 signs, don't take them for granted. Number 1, swelling in the body. Number 2, reduced urine. Your urine is very reduced. You're drinking a lot of water, but you're not urinating well. Like, it's obvious, you can tell. Then persistent fatigue. You're always tired, feeling weak. Please, don't take these signs for granted. See a doctor and let them do proper diagnosis. The one unique thing about the kidney, if it is attended to quickly with certain medications and interventions, it can be reversible. Yes, acute kidney failures are reversible, but when it becomes chronic, that is when it becomes an issue. It tells you that, if you must have heard people say dialysis, now you're using a machine to filter the waste. It's not cheap, it's very expensive, so you don't want to get to that point. So when you notice these little signs, don't ignore it and take it for granted. Please take your health seriously. You need this body to be able to go about your day-to-day. That's why they say health is wealth. If you like what you're watching, please subscribe to this channel, share to friends, and drop some comments to encourage us and likes. Thank you.